health. After working as a physician in Venezuela for some years. And then after that, I was the director of HIV programs in Detroit. And then after that, I went to California to do radio. And I was doing radio in a radio station called La Voz. It was a 24 hours talk radio talk show in Spanish. The first one, 24 hours. And I was in charge of La Familia y su Salud, taking phone calls, in live programs, which was an incredible experience. I think that every experience that I have had, and in that sense, I think I have been very, every experience I have had since I was born has informed something that I'm doing right now. When people say, where did you learn to do fundraising? I said, I learned how to do fundraising when I was 5. It wasn't the level of fundraising that I do now, but it was a level. Because I remember 5, 6, in my elementary school, we had a group, a non-profit, that used to come to my school to ask for collaboration, selling raffles, to get money to buy vaccines, polio vaccines. So I don't remember exactly the face of the lady, but I remember that she was very compelling. And she would go and say, you know, if we don't vaccinate these kids, I mean, you are kids, and if we don't vaccinate them, they might be paralyzed. And they would show us a little kid that was paralyzed, and that really moved me for the rest of my life. And I said, you know, they are going to be paralyzed if I don't sell raffles. So I really need to sell raffles. And for me, it was a personal thing. I needed to sell so many raffles. So I started telling people why they needed to buy the raffle. And they needed to buy the raffle because there were kids that were going to be paralyzed if they didn't buy that raffle. But if you think about it, there are so many things that form us. Think about the conversations with your parents. Think in the neighborhood where you grew up. Think about why you want to go to medical school. Think about it. And think in your answer. They might even ask you, if they haven't yet asked you, why do you want to be a doctor? Have they asked you that? In school, have they asked you to write why you want to be a doctor? See? Just like a person, a friend. And what did you say? Or other doctors? Are you already a doctor?
No.
Are you going to go to medical school? Are you in medical school?
I'm going.
You are going to medical school. So why do you want to be a doctor?
Because it fascinates me and I feel like I can
Make a big difference. It fascinates me. Curiosity. How does this work? What else? For example? Right. Did you hear? No?
You want to have how, perhaps one of the things that shaped you when you were young, you didn't have access to health. And so when you grow up, one of the things that you want to do in life is, well, personally, I want to provide health access to people who don't have it.
It's that commitment. You know, I grew up like this, I grew up seeing this, I want to change that. Anyone else? Now let me see me with the mic here. Relax. Who else wants to be a doctor in this crowd? Do not raise your hand because I'm going to give you the mic, right? Why?
I just want to make a difference in people's lives, and I hate seeing people sick and not getting the care that everyone should have the right to.
Anyone else wants to share?
I want to be a doctor because my family and I experienced the lack of help to people. For example, one of my siblings was born premature at 6 months. There wasn't enough doctors to try to help her. So,
and I'm not saying that you don't want to be a doctor so you can make some money, have a good career, an interesting career. You know, we want to learn about the human body, we want to learn, and we were curious about that too. We want to help, and we want to have a job that also helps us live a life that is comfortable. So the majority of us, when we are going to medical school, think like this. The vast majority think like this. Then we go to medical school, and then we enter a machine that sometimes transforms that heart. And it's not, I wonder why. You know, and I can have my explanations, and you guys can have your own explanations. But there is something about pressure. There is something about the economy. There is something about growing up and trying to somehow fit a model of what is expected of you. And at this moment in our life, you know, when we are going into medical school, and it's not only medical school, it could be also education, it could be social work. I mean, there is a moment in our life in which we can defend that. I want to help. And there is nothing wrong with that. How old are you? 17. God, you're young. 17. So I graduated when I was 25. So I went to school also very, very young. But when you are 17 and you say, I want to help, and it's not fair that people don't have access to health care, people look at you like, or when you are 26, 30, 34, 40, and you say, I want to be a doctor because I want to help, people look at you like, what's wrong with him? What's wrong with, like, you don't talk like that when you're 40. You don't. You're supposed to talk about medical and reimbursement. You need to talk about kids and debts and the fact that you're paying a house and the mortgage and your investment and the lack of opportunity for savings and this hospital and how they are driving you crazy with the administrators that are not helping you. That's how you talk. You don't talk about, I want to help my community. Healthcare is a right. I joined this career so I can make a difference. Because you feel stupid talking like that. And that is a disgrace. It is a disgrace that you cannot feel proud of saying what you are saying now when you are 40. But the worst part is that the majority of them that will look at you like that wish they could still talk like that. And at the end of the day, when they go home and they feel empty, they think, I used to feel different. I used to feel that my life had purpose. When did that disappear? And that's why I came with Alex all the way from Santa Ana to this university to tell you this. And if you want to remember one thing about what America said today, just remember this. Forget the rest. Remember that you will have to protect that. Our commitment in Latino Health Access and my personal commitment and my professional commitment has been to defend that. And I am 56. So far, so good. So far, so good. But still some people say, why did you do public health? I mean, you could be something that makes more money. Why public health? So you will have you will be challenged. You will be challenged when you say, my nephew, my little niece, my sister, this was my experience and I want to help, you're going to be challenged. They're going to say, well, did your family have documents? So you know why they didn't get care? Because they were not here with documents. And that's what happened. So they look for it. Why they didn't stay in Mexico? So you will have to defend that. You will have to talk about health as a right, as a universal right. So at that moment, you're going to say, I'd rather not talk more about those things. Because every time we talk about that, we are challenged. Until people stop challenging you. Because you can demonstrate that what you are saying and doing makes sense. Then they invite you to talk, and then they pay you for that. So we have to hang in there with our beliefs, because I think we believe in something that is very important, that we need to protect. So I'm going to tell you the story, a little bit of the story of our organization, together a little bit with our own challenges, as we are trying to defend these positions, this way of seeing health and community health. So one of the things that I wanted to share with you to start this conversation has to do with the World Health Declaration. The World Health Declaration comes from the World Health Organization, that is called WHO. The World Health Organization is this international institution that set goals and guidelines and that provide philosophical declarations. Philosophical declarations. They don't give money. They receive money from a lot of countries around the planet. So they are the ones that say health should be seen this way. And then the rest of the countries say, wow, the World Health Organization is saying that. And then they forget about it and they do whatever they want. But what the World Health Organization says is extremely important to the way we conceive healthcare and health practice around the planet. So the World Health Declaration of 1998 says, we, the member states, these are countries, the member states of the World Health Organization reaffirm our commitment to the principle enunciated in its constitution that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. In doing so, we affirm the dignity and worth of every person and the equal rights, equal duties, and shared responsibility for all for health, which is what you were saying. So now it's not you. What's your name? So Victoria, this is not Victoria's opinion. This is the World Health Organization opinion. So when I say that healthcare is a right, I agree with the World Health Organization. And this is the world saying it has to do with dignity. Healthcare is a right because it has to do with dignity. And the best way of thinking about this is thinking, how do you feel and how do you look when you are sick? Thinking a person that is very sick. Very sick. Think about a person that has a skin problem. Think about a person that has a skin problem, this rash and something else, is vomiting. Or the person has diarrhea, is losing weight. The person has HIV, or the person is having a baby, and at that moment that she had the baby, she's left with no energy, full of blood, naked. Think about a person with colon cancer. Think about an operation that is about colon cancer. What happened? What substances? The person cannot work, cannot move. What is at risk? What is it? I mean, this person cannot work, cannot go and buy rice, cannot cook. Really, the person and her dignity. That's it. That's it. So, when you are like that, you are nothing. And you have a country that doesn't care about how you are, if you live or die, if you suffer or you don't. You have a country that doesn't care about your dignity. So health and healthcare is about dignity, and that's why it's considered a human right. And it might not be necessarily seen as a right by some countries in their own constitution, but it is considered a human right. So part of this declaration also says, we recognize that the improvement of the health and well-being of people is the ultimate aim of social and economic development. We are committed to the ethical concepts of equity, solidarity, and social justice, and to the incorporation of a gender perspective in our strategies. What they are saying is that also health needs to take into consideration this whole conversation about being gay or lesbian or transgender or bisexual. I mean, that we need to talk also about the health of women and men. It's not health is health and also paying attention to special groups that are ignored. I mean, if the majority of people are ignored, these special groups are even more ignored. And that's why the World Health Organization says we need to incorporate a gender perspective. We need to talk about women and men. Because a lot of women are dying. They are dying when they have the babies. They are dying after they have the babies. They die while they are pregnant. A lot of women, millions of women, die in the third world in something related to pregnancy and delivery. So, is there a priority to protect women? So, but they also talk about social justice. So, what happened with this when this goes to a hospital? It becomes, you see patients, you send them home, they come back sick again, you see them and you send home, and you build insurance. That's it. At the end, it becomes that. Well, we are saying that it shouldn't become that. And the system is recognizing that it's stupid to just do that because you don't save money. On the contrary, it's more expensive if you don't invest in prevention. If you don't invest somehow in making sure that this person doesn't come back, it is in your interest, even if you don't care about that family. I'm sure you would care in saving money. So, it makes sense to pay attention to the person and the family and the community. It makes financial sense and it makes human dignity sense. And then they say, we emphasize the importance of reducing social and economic inequities. So they are talking about reducing economic inequities as part of the health agenda. Therefore, it is imperative to pay the greatest attention to those most in need. And at the end they say, priority to those affected by poverty. This is important because the concept of health from the World Health Organization, are you familiar with that concept? What is the concept of health? What is the concept of health from the World Health Organization? Do you remember, are you familiar with that? They say health is the complete state of well-being. Physical, mental, spiritual, and social. And not the mere absence of disease. So the World Health Organization says that if you are not sick, it doesn't mean that you are healthy. It doesn't mean that because you don't have diabetes, you are healthy. If you are stressing out, if you don't have a way of finding food, if you live in, and I can even ask you, just very fast, when you think in a healthy community, if I say, you want to move to a place, you are going to buy a house, you want to live in a healthy community. What is a healthy community? One thing that makes a community healthy. Participation and involvement in a community makes a community healthier. It's great. And I agree. What else?
Access to healthy food.
Access to healthy food. What else? Water. Education. What else would you like to look for in that community where you are going to buy a house?
Proper doctors for population.
Doctors are available.
Social support.
Social support.
Peace within the community.
Peace. Which I like the word you selected, peace. Because people talk about safety, but safety is also around peace. It's not just more police. It's not more police. More police might make you safer, kind of, but not peaceful. So peace is important. Now, you could say, I live in a very healthy neighborhood because no one has diabetes. Every night someone is killed, but it's pretty healthy because no one has diabetes. So the World Health Organization says, no, it's not like that. It's not the absence of disease. Health is way more than that. Health is about wellness, but it's not just wellness physically, it's mental, it's spiritual, it's social. Is that idea that I am healthy, I live in a healthy place, my kids can be healthy, they have opportunities, they will be able to accomplish a lot of things. That's what the World Health Organization says. So I don't know how many times you're going to hear that during your career. I hope that you hear this a lot of times. But if you don't hear it a lot of times, maybe you can just write a little note. And when you feel down, like you are tired because now you have seen the anatomy book for 3 weeks, and you cannot memorize all of that, but you can still remember, okay, this is worth it, because at the end of the day, this is what I see. I see myself as a doctor that can build healthier communities. Not that only can see sick people, seeing sick people is part of it, is a very important part of it, but preventing illness is a great part of it too. So this is another term that you are going to hear a lot as we talk about health, is this health disparities idea. What is a disparity? That sounds like what? Distress? What else sounds like a disparity? Distance between two groups. In public health and in health, you talk about disparities, or in economics or education, you talk about disparities always comparing this group with the group that has more privilege. Always with the group that has more privilege. So if the group that has more privilege are this particular group in Mexico that has these houses that are very elegant, but the indigenous people in Mexico do not, then you compare mainstream Mexicans with indigenous Mexicans, and you see the disparity. It's always thinking in the most privileged group. In the United States, the comparison is with whites. Not because all whites are healthy, but because it is the privileged group that has the best indicators. And throughout history, it has been the privileged group. Again, it doesn't mean that all whites are privileged. Clear? So this is how the Center of Disease Control and the government compares. In health, the Latinos, the blacks, the Asian, the Native Americans have a lot of disparities in comparison with that population and die younger. And many of the disparities affecting the Latino community include diabetes and heart disease. It doesn't mean that white people don't have heart disease. It means that Latinos proportionally have more, or that have more complications because they get access to services later, etc. There is a whole discussion about disparity. But then, it used to be that people say, well, you know, the Latinos or the Native Americans or the blacks or the Asians or whatever have more of this disease because maybe it's in their genes. And that is, you know, the genetic piece of it might be a reality for some conditions, but already the conversation is way beyond that. Understanding that disparities are also associated with something very interesting, talking about curiosity. The reality is that the place where you grow up, the place where you live, the place where you go to school, the place where you play, the place where you work, that place has everything to do with your health. The place where you live, the place where you play, where you work, has everything to do with your health. And if you grow up in a place that is conducive to disease, that is designed to be sick, you are going to develop more diseases than a person that lives in a better place. So place is extremely important, and the World Health Organization talks about place as something that defines your opportunity for health, or not. So, in that sense, then all of a sudden you start thinking about the root causes. What caused this disease as something that goes deeper, 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 deeper. And I like sometimes to think, and I'm giving all of this framework to you so you can understand why Latino Health Access does what it does. So it's not that I'm not going to talk about Latino Health Access or the Promotoras, but I want you to see why we do it the way we do it. And I'm going to show you how the place looks in Santa Ana. But I'm talking to future doctors. And if you are ready to be a doctor, you are ready to go deep into this. This is not about how to put Band-Aids. This is a little bit more complicated. You are getting in a very complicated career. We are going to be in a lecture for 5 hours with a person that is reading, and you still have to be awake. So this is complicated. So I want to give you all of this introduction about root causes. But it's almost like if I ask you, this kid has asthma. And these other kids also have asthma. And they live in this very poor neighborhood. And they go to the emergency room, and then they go home, and then they come back the following week with asthma. Why do you think they are going back again and again to the emergency room? They don't have insurance, right? So, as I ask these questions, I'm going to go deeper into what is called the root causes. So I'm going to work with you in that path. So, okay, they don't have other place to go. Why not? The location has little to offer. Why? Jobs? What happened with the parent jobs?
Well, they have to stay there because that's where they work, and they have to stay in that area.
They are limited by the parent's job, that's why they live in the area. And how is the area where they live, more or less? It's a low-income community, so how does it look? Anyone have seen a poor community ever?
Yeah.
Okay, can you tell me more or less what? In an apartment complex? Small, crowded, next to a freeway,
There's no playground, no exercise areas.
no playground, no exercise area, graffiti.
There's playgrounds, you just deal with dumps, there's dump everywhere.
Absolutely.
It's polluted, I've been to TJ and I see the worst images as possible you can ever imagine. And in this case, if let's say it's indigent people, they're going to a certain place, maybe because they can't afford a car and they can't afford to go to certain areas where they can get better health solutions.
Right.
So maybe that's why, that could be one possible reason. And if they keep getting this disease, it could be because other people in that community have it as well. So they're getting it from them as well.
So in this case, this asthma is connected also with the presence of roaches and mold and old carpets. And so is it possible that they have roaches because of the place where they live? And why do they live there then?
Affordable.
What?
It's affordable.
Because that's what they can afford. Why?
Their education, the level of education is cheap, and that's their income.
But because they have the income, because they have a certain level of education. Why?
They perpetuate from their parents again.
Because maybe the parents were also poor. Why? Lack of knowledge, lack of opportunities,
There's no opportunity, so it's a lot of social immobility.
social immobility, lack of opportunities, immigrants. So as I talk, I started here. So, well, this kid has asthma and is coming to the emergency room all the time because they don't have another option. Because maybe they don't have insurance. Because they have low-income jobs. Because maybe the parents didn't have the opportunities and they have to live in this neighborhood that has mold. And I'm moving somewhere, right? I'm moving here until I get to a point in which this is the root cause. These are the reasons that are perpetuating that. Now, we are going to talk about asthma. Now, this kid is or this person has diabetes. And this person is going to the clinic to see you. And they don't even know what is the level of the glucose, or is seeing Antonio or Alex somewhere. And they are about to go blind. They don't have insurance. Now you know their glucose is very high. They might be at risk of losing their leg. Why? Same neighborhood. Why? Lack of treatment, why? Lack of screening, why? Because they don't have income, why? Because education, why? Same thing, so I'm going to work that way. Okay, we're done with diabetes. And I'm going to do the same with dropping out from school. And I'm going to get there. Then I'm going to come back and do obesity. And then I'm going to do cancer, breast cancer, that you didn't know you have because you don't have access to mammographies or to the education. And at the end, what happens with disparities is that they have to do with a bunch of things that are forgotten by the medical system. And that's where, as a physician or as a person in public health, you want to make sure that you don't forget about that, because it is overwhelming. You are going to see the kid that comes with asthma, and we end up just giving the treatment and seeing the kid the following week and giving the treatment. And when I graduated in Venezuela, that was my dilemma. My dilemma was that I was seeing the same kids every week with a different diarrhea because these kids didn't have to clean water and sanitation. They didn't have access to medications. They didn't have access to a bunch of things. So my question was, well, am I going to be doing this for the rest of my life? And I think that there's nothing wrong with the decision of doing that for the rest of your life. But I think we need to do that and something else. Not only for me, but for the community. Because otherwise, you know, you are 17, you are going to be graduated when you are 20-something, and you are going to live until you are 140. Really? For real. I'm going to die younger than that, probably at 97 or 102. But you are going to die at 140, because people are living longer. And you don't want to spend the rest of your life, you're 17, seeing the same kid with different diarrheas. Because that's pretty boring. And I think that it is your responsibility in the time of YouTube and Facebook to think, how do we bring clean water? You know, just to go the extra mile so you say, I'm doing something else that is not just prescribed. So we need to find a way. And if you think that these are the root causes, not having parks, not having a voice, not being organized to say, I have the right to have a good school, I have the right to have health insurance, but you don't have a voice that is organized. Because people that have the money and the power do have insurance. So this community doesn't. So if you say, well, what happens if I organize the community? What happens if the community gets organized? What happens if we get better jobs? What happens? What happens if we vote? And then we get immigration reform. And we get, for some we get power. And we get Affordable Care Act. And we have access. And we have better schools and better neighborhoods. What happened? And then what happened here? We have less asthma and less diabetes. So the idea, when you think in the health disparities, health equity framework, the idea is that you need to work to identify the root causes, and then you need to come back. But you need to address that. You cannot ignore that. When I was the director of HIV programs in Detroit, I remember also this dilemma. I have been a girl of dilemmas. And my dilemma was that I was seeing a lot of women infected with HIV that didn't know how to read, were partners of people selling drugs, and we were expected to give condoms to them. without paying attention to the fact that they didn't know how to read. And that they were partners of people doing drugs. And that we didn't have drug treatments for women with kids. Still, my grant was to give condoms. And I want you to see something fundamentally wrong with that proposition. You are seeing a woman that doesn't know how to read, that is doing drugs, that has 3 kids, and the only thing you can do as a professional is to give condoms. What would you do? What would you do? Say, that's my job. Is that what we're going to do? Well, you know, that's what the grant says. And you know, until from 8 to 5, I am the coordinator of HIV in Detroit. So at 5, I will see if I can help you after I stop being the coordinator of HIV. So that's how life will challenge you. They are going to say, so you said you wanted to help people, but this is your job, and you have to give them condoms. But I think we should help them doing some other things. We are not paying you to think about that. We are paying you to give condoms, right? That is the day that life will make you take path or say something. And I'm not saying you need to be disrespectful or anything. I think we need to contribute to the understanding that that's not the way to do it. So of course we did more than condoms. And of course we talked to these women about a lot of things. And of course, you know, the AIDS definition, my friends, back then, only included the body of men. If you take a book from 1988, 1989, and you find what is AIDS, you are going to find that AIDS is a disease that affects men. And that it looks like this, and then it shows Kaposi sarcoma and the different cancers that are... So women were dying without diagnosis. In our watch, women were dying without diagnosis. And their diseases that were caused by HIV were not recognized for them to receive financial support. They were not eligible. Am I explaining myself? Is this like too far from your understanding of health, or are we in the same page? So, you come to a doctor, you are a woman with HIV, I have this problem in my breast, or I have this problem in my reproductive system as a woman, and you say, I'm sorry, I cannot diagnose you with AIDS because you are not in my book. Therefore, you don't qualify for anything. Then you die, and you recognize that the woman died of AIDS, but still the definition doesn't include you, so I'm sorry. Or you change the definition. So we organized all the programs in the nation and created a huge movement. By 1990, the definition included women. So you have to do what you have to do, and you have to be strategic. And you have to learn how to do this without becoming a problem. You have to be strategic, because you are becoming a generation of leaders for a healthy planet, not just doctors. So you also need to learn how to lead. Like the doctor that actually teaches this class. Raul is a doctor and he's a US representative. Might be interesting to have this conversation about being a doctor and being a leader. Okay. So now let's see how this looks. How this plays in the community. This is Oakland, California. They did a study. It's a great study, and actually they inspired a series in PBS that is called Unequal Treatment. Equal treatment? No. It's called Unnatural Causes. You know when people die of natural causes, they say, she died of natural causes? Well, this video is called Unnatural Causes. When you die of unnatural causes. It came out of the working on. They established that if you are born in West Oakland and you are an African American person, you can expect to die almost 15 years earlier that a white person born in Oakland Hills. That was established, scientifically established. And for every $12,000 in family income, every 12 more, you add $12,000 to the income, one additional year of life expectancy. From this side of Oakland to that side of Oakland. Why? What was happening here that was not happening here? That is making that. So in Orange County, we have several very poor zip codes. In the 92703 is the poorest, and then the 9701, etc. We have concentrated our work here in this zip code. You want to know that well-being, this is today, what is known today about well-being among children. You want to know that well-being has to do with the fact that kids, it has multiple domains, and kids, to be well, they need to be able to manage emotions, to feel safe, to feel connected, to feel that they are effective in their competencies, that they have a positive self-image. We know all of this, and we know that at the root cause of emotional illness and lack of self-control and behavioral problems at school and behavioral problems in the streets and then mental illness or prison, at the root cause of that, there is a brain that is being affected by its surroundings. And that has been demonstrated. If you're curious, and you should be curious, you need to know about brain research. What is science saying about brain? So we know, based on science, that the place where you live designs the architecture of your brain. And that is extremely important. So it's not only that you are hungry, but if your mom is not there, if you don't feel safe, if mom and dad are busy all the time, or if you feel threatened every day in school, that is going to be shaping your brain and many other things together with your brain. So I want to share now, I'm going to move into the Latino community in Orange County. I know that many of you are not Latinos, but we work mainly with Latinos in Orange County, and I'm going to use this as an example. If you are interested in doing this with other populations, then, please do it. Because we need to document why we do things and gather the data that can give more value to our work. So, in Orange County, we have 50% of the youth population, half of the youth population are Latino. And here is where they are concentrated. They are concentrated in this area of Orange County. This is the map of Orange County. A little bit here, a little bit here, a little bit here. And this is the concentration of poverty among children in Orange County. Does this need explanation, or you can see what's going on there? Is pretty clear? Okay. So this is where the Latinos, the kids are, and this is where Latinos, children that are poor, are. This is where juvenile probation is concentrated. And getting worse among Latinos, better among other groups. This is the concentration. This is the pie chart that shows what is the ethnicity of the kids that are removed from their homes to be placed in foster care. And in Orange County, the vast majority are Latinos, which creates an issue of proportion. And it's getting worse. I want you to know that it has been demonstrated that they did a study in a federal study to find out what are the characteristics of the adults whose kids are removed and placed in foster care. What are the things that are affecting them the most, these adults? And they found out that in the majority of cases, there are poor parenting skills. These are the challenges of the caregivers. There is high stress in the family, low social support, trouble paying necessities, and here is domestic violence, which is an issue, and alcohol abuse and drug abuse. But I want you to see the other factors. So, and these are the adults in that same area. I want you to see where the concentration of adults in poverty is. The adults, the concentration of adults that do not have a high school diploma. You are aware of the role of preschool in the life of kids and in the life of this brain. Well, this is exactly the area where you don't have preschools, where you have the pedestrian injury, where you have the avoidable emergency department visits. The people using the emergency room of our hospitals live in that area. So somehow you are seeing that there is a place here. The whole opportunity situation is a place here. Everything is happening in that place. Now let's say you want to date one of the guys in that place. You will find a bunch of kids that are good kids, because the majority of our kids in the neighborhood are good kids. In that neighborhood, the majority are good kids, and the majority of girls are good girls. They are not in trouble. Whether the concentration of trouble is in that neighborhood. It doesn't mean that the majority of kids are in trouble, but that the concentration of trouble is in that neighborhood. So, since the concentration of trouble is in the neighborhood, the risk of my daughter getting in trouble is higher, correct? I always say that my kid who grew up in Anaheim Hills, which is a very nice neighborhood, my kid had many times sex without condoms. As much as I insisted and I taught them how to use the condoms. He probably didn't, he won't accept that, right? But I'm sure he did. And he did, who knows, I don't want to know. He's not infected. But if you have same kid, just a good kid, having sex in an area where you have a lot of infection, the risk of being infected is higher by virtue of your place. Correct? So it's not that you're better than me, it's that I live in a place that has more risk. So life expectancy is lower in that place. Park availability is lower. Very little availability, no parks, no open space. Very little availability. So now this is poverty among kids and obesity. This is Santa Ana. A lot of poverty, a lot of obesity. This is Irvine. Wealth and lower rates of obesity. And that's what we're going to see more and more around the nation. More and more. And then people are going to tell you, well, what you need to do is to teach them how to read food labels. And that will be enough. By the way, and we don't have money for more. So that's the project. The project is how to teach those Latinos how to eat better. And instead of eating beans with mantequita, the refried beans, maybe they can eat granola bars. And that will solve our problem. And I'm not saying that we shouldn't teach people how to eat, but I'm saying that that is an incomplete answer. So the place is important. In our place, we don't have places to play. Now I'm taking you, I'm inviting you to Santa Ana with me. Come with me and see the place, those maps. Now let's see the faces and the streets of that place. With a lot of obesity. Bombarded by media. Bombarded by media. And right now, they are trying to change all of these commercials because they have the public very, very upset. But we put this in the morning in our neighborhoods, and they put this in the afternoon. This is a fight of poor, lonely broccoli against the machine of Coca-Cola or McDonald's, with very little chances to win. Because I have never seen a kid that goes out and says, Mom, buy me a broccoli. So, this is a great slide that I love about, the design. There is a social design for people to walk or not walk, or go out or not go out, right? So, if you are a hiker or biker, you need to move to the side of the road. Just this place. Make sure you get very close to it. And this is one of our most famous pictures. It went around the world. It went around, and I have seen this slide everywhere. But this is in Santa Ana. This is what was called a park in an area that we say doesn't have parks. And they say, yes, it does. That is called French Park. So America, stop saying that we don't have parks. You are destroying the image of Santa Ana. Because that is the park. Well, it says there, passive area, not active sports. So that park doesn't work to fight obesity. Because you need to sit the kids, stay quiet. Imagine you're playing with a ball. And that doesn't waste a lot of calories, as far as I know. So as you can imagine, sometimes we get in trouble. Because we dare to say, that doesn't work for our kids. This is a typical building. Someone was describing a building like that, right? I think it was you. In which we find these signs. So you are a doctor. And you are seeing a kid that is overweight. Now you graduate. And you tell that kid and the mom, Señora, Luisito needs to go to the park. And la señora dice, ay, mija, pero we don't have any park. So, well, then let him play outside their apartment. Y la señora ya le da vergüenza. Now she's embarrassed and she says, okay, doctor. Now, because she's being embarrassed and she doesn't have parks, she lives in a place that has this sign. And you as a doctor say, good. So did you understand what I said? Yeah, well, but. And then you say, I'm such a good doctor. And then the kids come back and he has more weight. And then you say, these Latinos no hacen caso. They don't comply. No, doctora, what you need to do is come with that person and walk that neighborhood. So when you give an advice, you don't look stupid. Giving advice that nobody can follow. Because you have not moved from your office to see where the families that you serve live. And once you do that, then what? You're going to rescue them because they don't know how to improve their lives? Or are you going to invite them to somehow come up with a solution? This you maybe can't see very well because we have these slides, but it's okay. I hope you can at least see that this is a dumpster and the kids are playing inside the dumpster. And if we turn off the lights, which we are not going to do, you could see the whole dumpster here with garbage and everything else, and toilet paper. And I did this presentation in Chile with a group of children hospital, and a nurse said, well, at least they are smiling. And I felt so offended that I didn't say anything, because when I feel very offended, I have learned that it's better that I stay quiet. I learned that. And I said, I can't think of anything nice to say, so I'm not going to say anything. Because I'm sure that her kids play in a place that is decent. And these kids look like my kids. They are my kids. You are my kids. When we have a kid, we have all of them. I am one of those kids. I'm not a doctora ni a master in public health. I'm not of that. I am a Latina, and I never forget that. Never. And I haven't allowed any system or any degree or anything to separate who I am from who I am. And the eyes that see these kids playing are the eyes of this woman that is a Latina that think that this is not right. Because it's not right. Punto. And when you see the pedestrian injury data, and you come to the place, that's what you see. That is the kid that is going to be killed. Playing with the ball. And that is not right. It's not right that a kid can be killed because he doesn't have a part to play with the ball. Es así de simple. Hay cosas en la vida que o son correctas o no son. Is this right or is not? It's not more complicated. Don't give me any meta-análisis de nada, hombre. $3 million for un research, $3 million for a research to see why kids get killed. You know, I can take you there for free. And give me the money to build parks, right? So we need interventions that are not just here. With you as this incredible emergency doctor. In this wonderful Riverside Memorial Hospital, or qué sé yo. And you are in this emergency receiving kid after kid that has been killed or is disabled because she was after a ball. Now you have been working in that hospital 5 years, receiving kids that are killed because they were playing. Now you have been there 10 years. Now you retire. Clap, 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 clap. And they are going to give you a diploma for all your commitment, 30 years to healthcare. And you never bother to go to see where these kids were being killed. That's wrong. The first kid you receive, you have to say, where do they live? Are there lights there? Are there stop signs there? I'm not going to be here just receiving kids that are killed from a corner in Santa Ana. I am the doctor of this town. And I need to go, and I don't practice in this country, but you will practice in this country. I'm in public health. And as a public health professional, I do this. You are going to be the doctor in the emergency room. And people are going to respect you very much because you are the doctor. Now, you, my respected doctor, have some power. And your community is desperately waiting for you to use the power to change this. So let's talk a little bit about our work. We believe that participation makes a difference. We believe, like our colleague here was saying, that without participation you cannot have a healthier place. We believe that your abuelitas, your tias, your aunts, your uncles, even if they didn't know how to read and write, they have wisdom. And that a bunch of abuelitas, if they are upset, will kick Obama out of power. And anyone else. A bunch of moms upset, you have to be terrified. Really terrified of what can happen when we get upset as moms. Because we're animals. We are animals. And we become even more animals. So I am trusting in our animal being when we organize this community. So, these are our kids, man. ¿Qué pasó? And I'm not going to say, Señora Maria, you know what? I know that you are the mom of Luisito, pero did you finish university? Because otherwise you can't participate. And we live in a world that is limiting participation to people that have higher education and that have had a lot of opportunities. So participation now is a luxury. And people are afraid because they are immigrants or because they have been excluded or because they are going to say something that is not correct or because they don't speak the language or because they are too busy or whatever. And without the participation of the people in these places, we cannot change this. Nobody's going to change this unless we change this. And that's why you have a window of opportunity. If you are coming from these neighborhoods or you have abuelitas and tias and primos and sobrinos in those places, you have a window of opportunity. Go to school, have fun, come back. And believe that those that you left there can make a difference. We just need to be invited, included, supported. So these are some of the people at Latino Health Access. We also work with children. Y yo no sé si actually, is it possible that we just turn off these ones? Pero no all of them because I don't want you to fall asleep or to start reading or doing text messages while I'm talking because I can't see you. Can you see better? So we have children and youth that are community workers. These are the adults. We have 45 adults that are community workers, and those community workers are moms and dads from the community. We have women that were victims of domestic violence and came to our agency with a purple eye, all bruised, and then they recover, they survive, and then they wanted to help, and then we invited them to help, offer them a job, a full-time job with health benefits, and then they are organizing women and they are running the program on domestic violence. And these are women from the neighborhood that are very wise and very caring, that now have a job, and their job is to transform their communities. And we have an old guy that was the founder of AA in Espanol. He was an alcoholic. He stopped drinking 45 years ago. He's very well respected. He's Don Alex. He's 76. And he leads our senior program. And we have people with diabetes that went through the classes teaching diabetes. And they are a team of community workers working with people like us, like the technical people. So I went to school and this is what I know. And I have something to offer. And she has something to offer. She lives in the neighborhood. And together we do a lot of things. But we also believe that the kids have a lot to offer. Our youngest promotor is 6. He's 6-year-old. And a 6-year-old is able to say, knock, knock. Good morning, señora. I just came to tell you that apples are better than pizza. Thank you very much. And they are awesome. And people say, how cute? And while they say, how cute, then we do the rest. And these kids are amazing. So these are the kids. These are Alex's kids from Duroville, which now is not Duroville anymore. So our community, our children from Duroville. These are kids. How we recruit them for Children Initiative is by telling them stories, and they come to hear stories, and then we talk about how important it is for the heart to receive training so you can be a good person. And the way you train your heart to be a good person is by doing good things. So we invite you to do the training of the heart. And we invite them to come in pajamas, and they come with new pajamas to pajama night. And they come to pajama nights in the school because that's the only place they can go. There are no libraries. They don't come out at night. This is the time to come at night with flashlights and have fun in pajama. My kids in Anaheim Hills have pajama night every Monday with cookies in the library. These kids never had pajama night because these are different places. Santa Ana doesn't have money to support the libraries. So, but we want our kids to read. Our kids can read without books, etc., etc. So we can go back and forward in the root causes forever, right? And we tell stories. And then we do outreach. We do outreach and we go and look for people. This is a very important concept that I also want to share with you. It's the concept of why should we look for them? Why do I have to go and find Mrs. Martinez? If I have the program on diabetes, she has diabetes, I mean, she's the one interested in coming, right? Wrong. In this business, we need to think like Verizon. That's our model. Verizon, AT&T, that says, you know, you want to connect with your mom? Do you miss her enchiladas? Do you want her voice teaching you how to make enchiladas? By Verizon. So we want to say, Señora, you know, the neighborhood and the street and these and the stores and the park and that, government office to get a vaccine and find a person that hates us and says, buenos días, ya llegó, ¿cuántos niños tenía que venir con los tres? Solo uno tiene la cita. ¿Qué hace aquí? You know, it's like, okay, you're not welcome. And then they say, I don't know why they don't come. They don't come, they don't want to see you, man. So, how do we make sure that we convince ourselves that we need them? It's not only them needing us. That if we want to have a healthier community, we have to extend an invitation to every single person in the planet. So we go out. Last year we did 100,000 outreach conferences, door by door, in stores, finding the people, everywhere, with the youth, with the kids, in Duroville, again. And these are the ones that are less than 5-year-old. Less than 6, I'm sorry. And we build doors so they can start practicing. So once they are 6, they are ready to go. And we have kids taking care of kids. And kids learn. And you know, some people say, well, will the community believe in the message of the promotora, of the community worker? Like, it's my neighbor. She's my neighbor. I know her. So now if my neighbor is telling me that I should eat this way, that I eat this, that this and that. She's my neighbor. I have seen her eating a lot of tortillas. I have seen her yelling at her kid. Now she's coming like if she knows something, and she's not even a doctor. Oh. So that's what happened. This is what happened. People are slower to trust the new skills of a local person. Now this guy says, people are quicker to trust and listen to someone from their own community. Well, yeah. That's why people hire Latinos to sell stuff to Latinos. And then you go to Spanish and say, oh, ¿de dónde usted? ¿De Guadalajara? Sí, mire, yo vendo esto y esto y te quiero vender porque yo soy de Guadalajara y yo te voy a la Chiva y todo el cuento. You know? So I talk to you about sports and beer and I drink Corona and todo, and now buy this. And then people go like, so how are they end up buying? So actually this guy might be right to some extent. But when you really want them to move into a direction of health, that will not work. It's not that fast. So this is what happened. What happened is that this promotora who lives in the neighborhood and is overweight, has diabetes, and yell at her kids, now is a promotora telling you that we need to eat better. And that, you know, with this and whatever. And so she's trying to help. And at the beginning you don't believe her. But then you see how she's changing. And now you see that she's losing weight or working on it. And you see her improving her life and becoming more active. And then you say, wow. If that promotora can do it, I can do it. And the difference is that if the doctor can do it, I cannot do it. But if Maria can do it, I can do it. So the power of the promotor is that once the person develops that relationship with the promotor, it creates a path in which the person says that is possible. Did I explain myself with that? So the otherwise people say, you know, for America it's easy. I mean, she has a car, she doesn't have to worry about the food that she's going to put on the table. She even can get time to go to the gym. For America it's easy. It's almost like I'm not any moral in that sense. You know, for her it's easy. People think it's not easy. But they don't connect the level of difficulty with me, what they do with their neighbors. So if you left a violent relationship and you were able to continue your life in spite of years of abuse, I am in a domestic violence situation, maybe I can do it too. There is this power, the peer power. So we have a diabetes program, that's Antonio, who is back there too. It's one of our promotores, and Sister Teresita is another promotora. And Alex is one of our coordinators. And I always love when they are here so they can say that I'm lying or not, you know, when I say this. So they do diabetes programs. We sell tamales to pay for eye surgery. Because there is a saying, a Mexican saying that says, we will do something even if we have to sell tamales. Well, we sell tamales to do something. And we want a healthy community even if we have to sell tamales. And then this is Senator Lu Correa making tamales with us. And then people receive services with their home. And I'm going to pass this one. We have a great healthy weight program. And yes, we teach people about food. And we teach people how to cook. But that's not the only thing we do. We also go and visit them at home, and we find them, and we track them, and we find them eating Cheetos. And they hide themselves so the promotoras cannot find them. And then they go like this, and then Gina says, show me your fingers. And they are all orange. So, but we are in the streets finding these little kids, because these little kids are our kids. And we see how they are doing, and we support the families, and then we have the children from the children promotores educating other children. And this was the project, the Alex, was a project in which he said, well, while we get a park, maybe we can create a park in a parking lot. And we got that van donated, and he transformed the van in this van, and then invited the kids to a parking lot where they used to gather and just do pee every week. And now he's doing that right here en este nuevo vecindario.
Mountain View Estates.
Se te aguaron los ojos, compadre.
Yeah, that's brings
That's
back
very
a lot of good
moving, very
memories
moving.
from my MPH program.
Yeah, very moving, because you know these are the solutions of today. Because you can't just say, well, kids, keep getting fat until we transform the planet. Maybe you will be dead by then, but it doesn't matter. You can't say it. You have to say, what can we do now? And then what can we do later? But today, this is a kid that needs a place to go. And I can be a little bit acid, in my comments, but really, people fight for parks for pets. And I think that pets have the right to have a park. But I also think that we need to fight for kids to have a place to play. So we all can have places to play. So these are the women of the neighborhood, walking in their streets, taking back their streets, claiming their space. And this is in our building. These are women that came to lead. They came to exercise, we invited to lead. And here is Irma, who has been portrayed in the Bill Moyers Journal, in many other TV programs. She was in Univision last week, or this week, because she was the first one saying, do you think we can get a park for the kids? 10 years ago. And then Irma, we identified this space with other moms. Can you see? Like a vacant lot there? You can see? Can you see it now? So this is Irma, over here. A bunch of moms. Out of this group, we have several promotoras. She's a promotora, she's a promotora, she's a promotora. This is Gina, the one that was waiting, the little girl. And this is the space they identified 10 years ago. And we fought the city, and we fought the city to get that piece of land so we could have a little park for the kids. 10 years. And I'm so proud that we finally, I'm going to show you the park. But 10 years. Half acre. I don't know how many wealthy neighborhoods fight 10 years for a little park. I don't know many. They don't. So here we are presenting the plan to the moms. And these moms are upset moms. And they want that park. And it's 2005, the moment we took that picture. And the journal, the newspaper said, these moms are trying to get it. These are the moms in city councils saying we want a park, and the kids saying we want the park. This was the day we finally did the groundbreaking for the park, and this is the park today. We opened the park June 1st. And piece of the land was donated by Northgate Market, which is the equivalent of Cardenas. And they don't fight, they like each other, but they, Cardenas is Riverside, Northgate is. So, good partners, great partners. And the private sector is a great partner. If they want to put, what happened is that the Gonzales from the Northgate Market didn't forget that they are Latinos and that they were poor. They didn't forget, and that was key. And these are my kids, not my kids, but my kids. And we also do mental health support groups in laundromats. These are the promotoras. And we do outreach, putting no a la violencia, not to violence. And we display soap. And then we put in the little cart in the soap, we put la ropa sucia se lava en casa pero se seca afuera. The dirty laundry, translate that for me, Diría Dani Rivera. The dirty laundry, you wash it in your house, but then you dry it outside. And then people come and get their soap, and they receive a card that says, if you know of anyone that are keeping secrets about violence, here is my card. That's Sarai, one of the many that came because she was a victim of domestic violence and became a promotora. And there she's setting up her tianguis, her thing about domestic violence to do outreach. This is Teresa, another promotora, and they are giving out tortillas. And they are telling people tortillas are part of the culture, but violence is not. And then they get into the line of the tortillas, that line there. You know the lines of tortillas where people get gassed and talk bad about everybody? So we go into that line when we talk about health. And so we invite people to talk about issues. And you have Rosalia facilitating here. Rosalia is a promotora, that's Don Alex. Now Don Alex, the one that was an alcoholic, is no longer seen as an alcoholic. Alcohol is not defined in Don Alex. Don Alex is a leader. He's an elder in our community helping people. And he's right there facilitating a conversation about how to make Santa Ana healthier. But the kids are giving their opinion. They are tired of these gangs and drugs. So they visit Lu Correa, the senator, and they talk about their issues. Because you know when was the first time I met a senator? I think I was like 30, or probably 30 something. These kids are meeting their senators at 12. And they are talking about transforming their communities at 7. So, I want them to be the mayors of this city and the next senators. Not to be afraid of this. They are visiting here the police station. They are doing a rally against violence. When we have killings in the neighborhood, we go with adults, we show there with bread and chocolate, and we talk to the neighbors. Because what was happening and continue happening, because we just started this, is that kids are killed and nothing happens. Nothing. And kids know that someone was killed there, and they go like, shh, nothing happened, school keeps going. And we have to say, something happened. And the adults of this community are here to protect you. So we do that. And this is Sarai doing the soap activity. This is Sarai doing the support group. This is Sarai now as a leader. This is a mom from the community that was invited to lead and to participate and to tell us at Latino Health Access how to do the work. We collaborate. We fight for our voice. We fight to open these schools so we can have more space for our kids. And we never forget that behind all the data, we have kids. So, thank you so much. So, we have some time for questions or reactions, and feel free to just say, I want to make a comment. You don't need to ask questions, and I don't need to give answers. We can just react and say, that presentation made me think about this. I wonder if whatever. The comment, please. And you can stand up, share your comment with the group.
Okay. Well, first of all, thank you for everything you do. I see how that needs to be done in every community, to have health workers doctors out there, outreach. And so I'm a